The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening from wherever you are in the world. Welcome back to another episode of The Fact Is. I am your host, Hollis Grant, and this week we are looking at, again, COVID. We're also looking at COVID at this episode. What did the military in Canada discover in old age homes in Ontario? Were the deaths from the seniors that happened? Because we know, the facts are, if you're over 70, this is not a good disease to get. If you have underlying health conditions, this is not a disease that you want to get. But if you are a healthy individual, you have a survival chance of 98%. So, if you're bedridden, in ailing health, in palliative care, in an old age home, retirement community, you may want to pay attention to the report that the Canadian military filed. Taken from an article from the Globe and Mail, Infestation, Sedation, and Neglect. Military report details horrific living conditions in seniors' homes. Dated May 26. May 26, 2020. A Canadian military report released on Tuesday chronicles horrific conditions at 5 long-term care homes in Ontario, ranging from poor infection control practices to neglect and abuse of residents. The Ontario government said it would send inspectors from the military of long-term care into seniors' residents to investigate the military's allegations. But critics said members of Premier My Friends Doug Ford's government should have been aware of long-standing problems at homes well before the military stepped in. In the report, the Canadian Armed Forces described one home using narcotics to sedate residents who are, quote, agitated and difficult over being confined to their rooms during the pandemic lockdown. But when you talk to them, the report says, they just say they were scared and feel alone, like they're in jail. 2 seniors residents are infested with cockroaches and leave residents in soiled diapers, the report says. Staff in one of the homes take up to 2 hours to respond to the cries for their help. And a third home is force-feeding residents and causing audible choking. Mr. Ford told reporters he didn't know the full extent of what was happening in the homes until he read the military's report on Monday. Mr. Ford said the results of an investigation by the coroner will be shared with police to look into any possible criminal charges. It's shocking that this can happen here in Canada, Mr. Ford said. It's gut-wrenching. The federal government deployed the military into homes in Ontario and Quebec in late April to provide humanitarian relief and medical support at the request of the 2 provinces. The military is also expected to produce a report detailing problems witnessed at 28 Quebec elder care centres. The 5 homes in Ontario have been hit hard by the coronavirus. To date, a total of 217 residents have died of COVID-19, the respiratory disease caused by the virus. All but one of the homes are owned by private, for-profit companies. The military says it wrote the 15-page report to ensure that its observations do not go unnoticed. It is with a heavy heart that I bring this to your attention on behalf of the Government of Canada. Public Safety Minister Bill Blair says in a letter attached to the report. Mr. Ford said he asked the Canadian military to extend its missions in the homes for another 30 days, asked why it took the Canadian Armed Forces to shine a light on the practices and that compromised the frail and elderly. Mr. Ford cited the military's 24/7 presence, saying they were able to detect things that inspectors could not by spending a few days in a home. You need someone very transparent like the military to go in there and say, here are the goods. As ugly and as heartbreaking as it is, here it is. That's where you get the real answers, he says. Well, Premier, speaking of honest and transparency, we're going to go to the publichealthontario.ca in a COVID-19 report. It's the COVID-19 case identification and attack rates. It's a PDF version that you will be able to see. And I will talk about transparency of the Ontario government. On page 13, case detection. We performed several sensitivity analyses in order to better account for impacts of underlying assumptions, including 1, lowering the estimated percent detection in individuals aged 0 to 9, 10 to 19 years by half. 2, using alternate estimates of infection fatality. And 3, increasing the number of reported deaths in each age group by 50%, except for age groups that had no reported deaths. Go back, increasing the number of reported deaths in each group by 50%, except for age groups that had no reported deaths. And below, reported deaths were inflated to assess the impact of potential underdetection of COVID-19 deaths. An inflation factor of 50% was chosen since, on average, several European countries reported underdetections of 50% in an analysis conducted by the New York Times. So the New York Times conducted a study, not a university, but the New York Times, a journalist, and said that they're under 50%. So the Canadian government, the Ontario government, decides to, and I'll read it in their own words, inflated. Reported deaths were inflated to assess the impact of potential underdetection of COVID-19 deaths. They're admitting to inflating the deaths by 50%. Says the Premier that wants transparency and openness. Now, the original Globe and Mail article goes on to look at the crisis at that time, just a few months old. Now, we're going to jump ahead in time, and we're going to look at an article from May 9th, 2021, from the Globe and Mail, saying, patients died from neglect, not COVID-19 in Ontario long-term care homes. Military report finds, quote, all they needed was water and a wipe down. Dozens of residents in 2 Ontario nursing homes hit hard by the coronavirus died not from COVID-19, but from dehydration and neglect, the Canadian military says in reports obtained by the Globe and Mail. The documents contain new details about the deplorable conditions in 2 Toronto homes before the forces stepped in last year, revealing for the first time that causes other than COVID-19 hastened the deaths of residents as outbreaks spiraled out of control and staffing collapsed. At Downsview Long-Term Care Centre, where 1 in 4 residents succumbed to the virus, another 26 died from dehydration before a military team arrived last June to provide humanitarian and medical support. At Hawthorne Place Care Centre, 51 residents died of COVID-19 in the 269-bed facility. The military says it suspects those fatalities pale in comparison to the deaths from other causes. Residents are dying from non-COVID-19 cases more than they should be. The allegations of death because of dehydration is, quote, not only troubling, but potentially criminal, end quote. Amber Irwin, a spokeswoman for long-term care minister Merle Fullerton said in an email on Sunday. According to figures published by the provincial government, 3,762 long-term care residents in Ontario have died from COVID-19. But no one is tracking the number of fatalities from other causes during the pandemic. The reports on Downview and Hawthorne were submitted to the independent commission that examined the devastating impact of the coronavirus on residents in long-term care homes, but have not been made public. The 3-member commission, led by retired Associate Chief Justice Frank Marco, criticized the Ontario government's response to the pandemic, saying in its report released on April 30th that it was slow, uncoordinated, and lacking in urgency. The government did not ask the military for help in 7 homes until the coronavirus was already tearing through the facilities, leaving them without enough staff to stabilize the increasingly dire situation, the commission said in the report. The report quotes from Ms. Fullerton's notebook dated April 17, 2020. Military plan needed. Get them in within 24 to 48 hours. Homes spiral down quickly. However, it would be another 12 days before the military was deployed to the first 5 homes, including Hawthorne Place, at the request of Premier Doug Ford. This delay, like others before it, was tragic for those trapped in homes with uncontrolled outbreaks, the Commission says in its report. The military arrived at 2 other homes, including Downsview Long-Term Care Center, in early June. In its report on the Downsview Long-Term Care Home, the military expresses large concern with the timing of its arrival. It was noted by the Augmented Civilian Care Team that 26 residents died due to dehydration prior to the arrival of the Canadian Armed Forces team due to lack of staff to care for them. They died when all they needed was water and a wipe down. James Balcom, Chief Operating Officer at GEM Healthcare Group, a Halifax-based company that owns the for-profit home, said company officials began pleading for extra provincial support with staffing at Downsview in late April of last year. It is tragic, he said in an email to the Globe, that emergency help from the armed forces and a Toronto hospital did not come until weeks later. 65 residents of Downsview died of COVID-19 last spring, ranking the home the 3rd hardest hit in Ontario. We will always grieve for those who died last year, said Mr. Balcom, adding that the home now has a new senior management team. We never want anyone, residents, family members, and staff, to experience what happened at Downsview and across the province last year. At Hawthorne Place, residents have died because of dehydration and malnourishment, the military says. When members of the armed forces arrived at the home, the report says they found feces and vomit on the floors and walls, 2 residents with dried feces under their fingernails, and management that was non-existent. Contrary to the report, a spokeswoman for Responsive Group Inc., the company that manages the for-profit home, said management was present in Hawthorne at all times. Nicola Major also said in an email to the Globe that the military did not bring any issues contained in the Hawthorne report to the attention of management. As well, she said, none of the death certificates issued for the residents cite neglect, dehydration, or malnutrition as a cause of death, because they were listed as COVID. Ms. Irwin, the minister's spokeswoman, said Ms. Fullerton received the reports on Downsview and Hawthorne last Thursday, and ministry staff met with officials in the office of the chief coroner the following day to discuss the revelations. The coroner's office is engaged and will be providing the ministry with their documents about deaths in the homes, Ms. Irwin said. Once the documents have been received, the ministry will be acting on them. The coroner's office declined to comment. In a report released last May, the military chronicled horrific conditions in the initial 5 homes it assisted, ranging from poor infection control practices to the neglect and abuse of residents. Opposition leader Andrea Horwath wrote to the Ontario Provincial Police last week asking it to review whether the Commission's findings constitute a case for criminal charges. So there you have it. The homes were disgusting. The residents weren't taken care of. A flu, and a very bad flu, was released upon the province, the country, the world. Bad flu year. And killed off people that weren't taken care of at astronomical rates. So not only was it the coronavirus, but you have to look at the condition of these elderly people. How were these citizens, these poor, feeble individuals, left with vomit on the floors, with feces under their fingernails, not being taken care of? Now we have to look at the report where the government admits to inflating numbers by 50%. So now you have people that have died from dehydration that have been listed as COVID-19 deaths. You have documents to say that the numbers have been inflated just to make sure the numbers are safe, because the New York Times says Europe was off by 50%, so we better increase our numbers by 50%. And how many people really did die? As we are looking to 2 weeks to crush the curve, and I believe it's week 78 that we're in now, of 2 weeks to crush the curve. Ontario still in a lockdown state. How much longer will this go on? How many needless lives have been lost lives have been listed as a COVID death where in fact it wasn't. It was neglect. The government is covering up. Everybody is covering up the incompetence of this virus. While we look towards America, and you look towards states that have gotten rid of the masks, have repealed the mask mandate, and how are they being graded? With school boards saying, no, we have to keep the masks in place. The same newspaper that said Europe was charging or falsified their information by 50% less, that same newspaper put out an article saying, an opinion piece saying, even if I was the last person on this earth, I will still wear my mask because it makes me comfortable. This article was from May 3rd, titled, "They're Vaccinated and Keeping Their Masks On Maybe Forever." Correction, published May 17th, 2021. And it goes on to highlight how these individuals will always wear their mask because they feel safe wearing their mask. As the rest of the world starts to take these masks off and return to normal, the New York Times is peddling fear. I'd like to thank you again for tuning in to this edition of The Fact Is. I'm your host, Hollis Grant. You have yourself a great week. We'll see you next time.